the bad guy from the Lone Ranger episode. So.
When this all started, I told my wife there's this comic book character named Grifter who has a mask. It starts up here and comes down, but he's got like long, kind of blondish hair. I was like, how did you find that mask? And it's like a red mask.
Or Bazooka Joe.
Yeah, oh yeah.
Dude, like, what is that? He was way ahead of his time.
Wrong generation.
Yeah,
Bazooka Joe.
but Bishop knew.
I don't know if you guys can tell I'm smiling.
That smile was eyes.
Yeah, right.
Yeah, apparently you have to have dreads like that, Bishop.
I tried that once in high school, didn't work out too well.
The feline moved from the printer. Yeah, I usually have to. I've got two dogs that usually are like bookending my chair. And I'm like, okay, who's where? But probably the last time I visited my parents, which was no doubt, my 9-year-old mother was a walker. She's trying to get out of the chair, and she's hello, what are you doing? She said, I'm trying to get up, and I don't want to disturb Sharon. The dog's lying next to me. You disturb Sharon by punching me in your ribs. You know, I said, get up.
You wore that just for me, didn't you?
Yeah, that'll be fine. This will be great.
Been so long since I've had to leave the hospital report that I got there.
Yeah, the woman took my temperature. Showed any symptoms. I said, I haven't hardly left the house. It's like my 4th trip out since March.
Yeah, no, that's fine. Yeah, you're forward.
I appreciate it.
Yeah, sure.
It's not you, Governor.
Just follow Alex.
Take the first one.
All right. Good afternoon, everyone. My name is Alicia Tate-Nadeau, and thank you all for being at the State Emergency Operations Center. For those of you that don't know, the State Emergency Operations Center is where the state really coordinates the COVID response, and we have been doing this since the very early, actually the late part of February, the early part of March. And to date, as we talk about masks and we talk about some of the 11 counties out there that are going up, we really want to focus on mask and mask protection. To date, the state of Illinois has sent out over 30.7 million masks throughout the state of Illinois. And of that, we will be sending approximately 2.5 million masks to schools. And we have also sent out over 450,000 masks to critical infrastructure throughout the United States so that we can continue to have production of our meat production and other utilities continue to work in a COVID environment. It is really my honor today as we stand here to introduce Governor Pritzker as we talk about moving forward. Thank you, sir.
Thank you, Joe.
Well, I want to just take a moment to thank General Tate-Nadeau. She has been doing amazing service during this emergency. I think all of you have known that. She isn't always on the front lines in front of the camera, but she is always working, honestly. I have spoken with her at all hours of the night and day, and I'm just so very proud to be able to work alongside her during this very difficult pandemic. The director knows better than anyone that you can't wish away a national or a state emergency. We have to respond, we have to prepare, we have to adapt our plans. As much as we'd like it, this virus isn't going away on its own. So we have to take responsibility. We have to take collective and individual action to protect the people that we love. In addition to Illinois Emergency Management Agency Director General Alicia Tate-Nadeau and Department of Public Health Director Dr. Ngozi Ezike, I'm here today with Springfield Mayor Jim Langfelder, with Senator Andy Manar, and with Representative Mike Murphy to highlight very concerning trends in our COVID-19 trajectory across the state of Illinois, including right here in our capital city. Information about the spread of COVID-19 in every county is on the IDPH website at dph.illinois.gov/county metrics and on local public health department websites. And I encourage everyone to go and visit those websites and look at the numbers so that you can better understand where we've been, where we're going, and what actions will need to be taken if we don't stop the spread or slow the spread. Under the leadership of Mayor Langfelder, the City of Springfield has taken critical steps to proactively enforce bar and restaurant capacity limits. Following the science and the evidence is the very definition of doing the right thing, and I commend the city for taking these important, decisive actions. But government action isn't the only answer. In fact, it's not enough by itself. We also need all our residents to take this seriously and to protect themselves. Right now, Sangamon County is one of 11 counties at IDPH's COVID-19 warning level. Counties that have recently seen outbreaks at businesses that aren't requiring masks, school graduation parties and social gatherings, people packing into bars, and in long-term care facilities. We've also seen clusters of cases associated with overcrowded restaurants and churches, big sports events, including soccer, golf, and softball tournaments, and an overall rise in cases among those in their late teens and in their 20s. And consistently, we have seen too many of these communities not wearing the most important tool that we have to reduce the spread of COVID-19 by individual action, and that is face coverings. Masks have been mandatory in Illinois since May 1st, and will continue to need them until this pandemic is over. With our COVID-19 infection numbers heading in the wrong direction, especially in certain downstate counties and rural areas of the state, and with greater compliance needed to overcome this health emergency, today I am launching a new mask awareness campaign with a very straightforward tagline: it only works if you wear it. Every day we do things that keep us safe, like buckling a seatbelt or putting on a bicycle helmet. A mask is no different. It only works if you wear it. So always wear a mask when you're out in public to protect yourself and others. Keeping it in your pocket or wearing it just around your neck doesn't work. It's really that simple. It only works if you wear it. I'd like to play for you one of the ads that will be part of this campaign.
Not wearing a mask in public is like not wearing a seatbelt because no one else is.
Or not wearing a life jacket because it's uncomfortable.
Or not wearing a helmet because it's just one play.
Or not putting me in a car seat because we're only going down the block.
A mask is like anything that keeps us safe. It only works if you wear it.
So wear a mask when you're out in public, because we're all safer and stronger when we go all in, Illinois.
So this campaign is going to use nearly every media channel available to communicate this life-saving message to the people of Illinois. You're going to see messaging on broadcast cable and connected TV, streaming audio and radio, billboards, social media, and more, in multiple languages as well. Based on the trends of cases on the county level, we will focus media spend on the cities and counties that have the most work to do. Folks, no one is asking you to wear a mask forever. But for the time being, until we see a very effective treatment or a vaccine, the best way to safely get to the other side of this emergency is for all of us to follow the mitigations recommended by doctors. Wash your hands, watch your distance, wear a mask whenever you're out and about. We've made so much progress since the beginning of this pandemic. Let's protect that progress. This is our moment to pull together as families, friends, and neighbors. We're all safer and stronger when we're all in Illinois. Thank you, and now I'd like to turn it over to our IDPH Director, Ngozi Ezike. Thank you. Doctor?
Thank you. I just want to reiterate what we've seen here and what the governor has already said. The campaign that we're launching today builds on the success of decades of public health campaigns that have turned safety precautions into everyday, regular practice. When you get in the car, you buckle your seatbelt and you protect yourself in the case of an accident, and that has saved thousands to millions of lives. When you play football or ride your bike and you put on your helmet, you reduce the risk of injuring your head and causing severe brain damage. And of course, when you're on the water, you use a life jacket so you don't drown. And of course, the mask is just the same thing. It keeps us safe, but it only works if we wear it. So please, let's wear a mask in public. It's the same message we've been echoing since the beginning. We're all safer and stronger when we go all in Illinois. Cuando conduces su coche, usas el cinturón de seguridad. Cuando andas en bicicleta, usas un casco. Esas acciones salvan vidas. Ahora tenemos que usar una cubrecara cada vez que salimos de nuestra casa. Esto ayudará a salvar su vida y las vidas de su familia, sus amigos y sus vecinos. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much. Happy to take any questions from members of the media.
I've got several questions from those who can't be.
I saw Bruce first, so I'm going to go with Bruce. Yes, sir.
You brought up seatbelts. You brought up life jackets. There's fines involved if folks don't wear seatbelts. There's fines involved if folks don't wear life jackets. If we look at the history of seatbelt use, for example, it became mandatory in Illinois in 1985, but folks didn't start really wearing them until fines were involved. With that said, 79% of voters surveyed last week by the Harris poll said that we favor a national mask mandate, and 70% of those surveyed said we favor fines. And so we've been through a lot of education. It's been all over television. You're doing, what do you say about starting to fine folks, as people in Miami has been started this, San Francisco has been started this? Should cities start fining people?
Look, the first thing that we ought to do is make sure that we're enforcing, and the way to do that, as you point out, is first to warn, because the idea here is not to chase people down on the street and say, you know, hey, you're not wearing a mask and I'm going to throw a ticket at you. The first thing is to ask people, remind people. It's often the case people have it in their pocket, they have it with them, or they have one at home, and they've just forgotten. And it's time for them to remember now that they need to wear it. But people who refuse to wear a mask, people who are entering public premises where they know they're supposed to wear a mask and who have been reminded and who aren't, those people certainly should be, reminded again by police. And ultimately, if they're absolutely refusing in public, they're putting other people at risk. So it's worthy of considering a fine at a local level. The same thing is true at restaurants, bars, and other public establishments. It's very difficult for many owners to enforce this without some methods of, allowing the Department of Public Health or the police or some other enforcers to come in and at least, remind everybody, put a warning in place for everybody in the place. It might be a large Costco or a Walmart or some other place. You want to make sure that most people are wearing masks. But again, I've said from the very beginning, the best thing for us to do is simply to remind people this is going to keep you healthy and your family healthy. And by the way, that has worked for the vast majority of people in Illinois. So there are people who are just refusing to do it. And at some point, those people are putting other people's health at risk and their own as well.
One of the campaigns that people that say they don't want to wear a mask is that, early on in
March, the public health officials and
Yeah.
politicians said they don't work. Can you go back and explain the thinking at that time? Was there an effort to reserve the PPE for doctors and nurses, or?
Oh, no, we were following CDC guidelines and recommendations at the time and continued to follow the science. As you know, at the very beginning of this, nobody really fully understood how this thing was transmitted. Nobody knew that you needed to have 6 feet of distance at the very beginning. Nobody understood that a cloth mask, if 2 people were wearing masks, actually would reduce the likelihood of getting it by a significant amount. At the time, we were following what was being recommended by the doctors at CDC, frankly. Now, I think, and actually very shortly after that beginning, a lot of information came forward that suggested that wearing masks is actually quite effective. And we saw in other countries that where virtually everybody was wearing a mask, the positivity rate went down to near zero in many places. And so this is something that is very important for us to adopt in the state. To make sure that everybody's wearing them. That's why we're running a campaign like this.
Governor, this is so important. Why not have the legislature come back to Springfield and actually pass these mandates and other social distancing mandates and regulations on businesses?
Well, we already have a mandate in place. What we're doing is asking, and actually many cities and counties are responding, that they have enforcement mechanisms of their own. That's how it works in many other states as well. And so we're doing exactly that. And you know that I went to the legislature and I asked JCAR to consider a rule that would impose fines when people are not requiring masks to be worn. They didn't want to do that. They wanted to consider legislation and then didn't bring up that legislation. So we certainly are considering what rule we could put in place that JCAR would approve. But I would say it's the legislature, it's true, that hasn't been willing to move forward on a mask mandate. But I have one in place for the state, and cities and counties have been actually very good for the most part about suggesting to people that this is enforceable.
How much does the campaign cost, and how long will it run, and does the saturation that you mentioned make it more expensive than the typical public health campaign of this sort that might be on?
I don't think it's any more expensive than another, at least on a per commercial, per ad basis. It's a $5 million campaign. We put out a press release this morning that highlights how that money will be spent, at least gives you an idea. And I talked about it a little bit too, a good deal on social media. We'll be on cable, we'll be on broadcast TV, really every kind of medium that you can think of. You'll find it on Hulu, on YouTube, et cetera.
Is it in the public health budget? Where's the money coming from?
This is actually dollars that the federal government provided to the state for a variety of things related to COVID-19, including this.
Governor,
for putting all this money into this.
Just gentlemen, I'll get you a mic.
Going forward, many police departments are saying that they really only enforce these guidances, especially here in Springfield, when a whistleblower calls and asks them about it or calls about a specific restaurant.
Yep.
So how can this help to be enforced locally, especially with any police department in Illinois? Should they be patrolling more? Should they be more vigilant with looking for people, or how should that go?
Look, there are a limited number of police who could do this. We've got a lot of other things that police are responsible for. So we're not asking police, as I said, to chase people down when they don't see somebody wearing a mask. Reminding them is a good idea. And certainly with establishments that are overrun with people who are not wearing masks, or have a majority of people or even a significant number that aren't wearing masks, they should be reminded that everybody there should wear a mask. And so we want the help of, and we want the same from the county public health departments and city public health departments all across the state. We have 97 of those local public health departments, and we're working in concert with them. Indeed, Dr. Ezike has a call very frequently with all of those departments to talk about the common strategies that we're going after in each city and county. So I actually feel like the combination of reminders, of enforcement at the local level, of county public health departments and police, making sure that people understand that there is enforcement in place will have a big effect. And I believe that reminding people, just bring the mask with you, make sure you're wearing it, don't wear it around your neck when you're in public, wear it over your nose and mouth. It's one of the most important things we can do to keep healthy and safe. Mike.
We're putting all this money into the campaign, but there are still people, as I heard last week and previously, that say, oh, well, this is all a joke. I don't want to listen to it. Now, what is the enforcement
Look, like I said, this is exactly what we're asking cities and counties to do, and indeed we're going to consider a rule to go to JCAR with an emergency rule that will allow us to do more enforcement. But I think, look, some people are just never going to get the message, right? And they're never going to want to wear a mask. And I think those people, I'm not sure what we're going to end up doing, right? You can ticket people who drive 100 miles an hour every time they drive 100 miles an hour, I suppose. But what I would say to those people is you're endangering the health and safety of your own family, of your neighbors, your friends, and everybody that lives in your community.
Governor, I got a serious question.
It's looking increasingly unlikely that Congress is going to pass a relief package for state and local governments. Can you talk about what that would mean for this year's budget and what steps you're taking to prepare for possible?
Well, I continue to do my part to make calls to make sure that people understand that Republican-led states and Democratic-led states all have this challenge of revenues that fell off a cliff because of COVID-19. There's certainly damage that will be done all across the nation. There certainly will be significant cuts that will have to be made to life safety, to education, to so many things that I care really deeply about. But this is going to be up to the Congress. They're the ones who have the ability to help us and to help all 50 states with the challenge that we all have. But there are going to be layoffs across the country, not just related to state government, but when you don't fund state and local governments, you're going to see, and you've already seen to some degree, layoffs, not to mention those who provide services to state and local governments, private companies whose contracts no doubt will be put aside because the money isn't flowing, because we don't have the ability to balance the budget in the way that we had originally intended to. Wow. All right, I did look at Greg. I'll let Greg have this question. Yeah.
Questions from Chicago reporters, if possible.
We're on the last question.
Chicago reporters, sorry, off topic. Republicans are talking about campaign finances in Madigan, and I haven't watched their press conference, but from what I understand, they're going to essentially say people shouldn't take Madigan's campaign money. Do you plan on making a similar type of pledge? Do you plan on not giving campaign funds that Madigan controls?
Yes, I will continue to not take money from others for my campaign, and I will support. Yeah, I will. I have, and I will. You can look and see. I've supported candidates, state senators, state house members, and others who are running, and I have continued to do that.
Will you be giving funds to Madigan, campaign funds that he controls?
That's not something I intend to do.
All right, thank you, everyone.
Thank you.
Governor, could he damage a progressive income tax?
That question was asked last week, so you should find that answer.
Yes, it was. That's Friday. I can't remember what you meant, but Friday. I saw the president.
I'm available to answer any questions the governor couldn't get to.